Hospital, Deputy McGrath.
Yes, thank you very much, Ciarán Corlin. I'd like to thank you for choosing this topical issue. It's an important issue for not just Cork, but indeed the Munster area. Minister, as a Minister of State in the Department of Health and as a Cork-based deputy, this will be an issue you're quite familiar with, I'm sure, and have an interest in. And I'm sure the government doesn't want issues around children's hospitals to be raised any further, but this is an important issue for the people that we represent. As you know, the national model of care for paediatrics has identified Cork University Hospital that it should be developed to become the biggest regional unit for the care of children outside of the National Children's Hospital. However, this development is predicated on the centralisation of children's acute hospital care in Cork University Hospital, CUH. The infrastructure required for this to happen is not currently there. In fact, no upgrade of the inpatient facilities has occurred since the original CUH, or Cork Regional Hospital as it then was opened in 1978, over 40 years ago. A planned new inpatient unit has been stalled at planning stages since 2015 and is now threatened, some would believe, by the significant overrun in the National Children's Hospital. And that's the first reassurance I'm looking from you, Minister, is that this project is not going to be affected in any way by that. The funding envelope for this project at Cork University Hospital, and this project has been known as the Munster Children's Hospital, is between 34 and 38 million euro, to include 2 below ground floors to accommodate 4 theatres and associated facilities. I think it's important to say CUH already delivers tertiary care across several specialties that other regional centres have to refer to Dublin. It is delivering specialist care as close to home as possible for paediatric neurology, respiratory, cystic fibrosis, endocrinology and diabetes, allergy and cardiology. And for the biggest non-Dublin population, children within Cork and Kerry addresses, for example, represent one of the lowest number of cases occupying secondary and tertiary beds in Crumlin and Temple Street. Over 90% of our children are cared for their entire treatment locally in Cork University Hospital, and the National Children's Hospital cannot afford for that caseload to change due to a lack of local infrastructure. In fact, it hasn't been designed with that capacity in mind. CUH has already had €9 million invested in its modern paediatric outpatient and day case suite, which I acknowledge, with other charity monies raised by the staff of the unit being used to keep phases 2, 3 and 4 of the overall project moving towards a planning application, hopefully later this year. The ongoing erosion of surgical and anaesthetic skills is a genuine existential threat to the delivery of all paediatric medical care in Cork. And this is what clinicians are telling me, Minister. It's not a politician making these claims. This is from clinicians. If these are lost, they would have they would have to immediately close to all acute admissions and close CUH emergency department to all paediatric cases. And again, where would they go in that scenario? It is a red line from their perspective. No airway support means no acute medical care for critically ill children in Cork. Cork hospitals perform over 5,000 operations under general anaesthetic on children per annum. Crumlin performs 22,000 or so. Obviously, there would be a huge differential in the complexity of the cases, and the National Children's Hospital is funded for 22 or 24 theatres to do that number, so it could not absorb the numbers that are currently being provided for within Cork. So what I'm looking for, Minister, is clarity as to where this project stands. I have been trying to pursue it by way of parliamentary question, and with the HSE, I'm not really getting much reassurance that this project is going to advance, and I'm hoping you can provide that today.
Thank you, Deputy Minister.
Thank you, Ciarán Corlin, and thank you, Deputy, and I welcome the opportunity to update the House on the paediatric development at Cork University Hospital. A national model of care for paediatric healthcare services in Ireland has been developed by the HSE and sets out the vision for high-quality, integrated, accessible healthcare services for children from birth to adulthood, with an emphasis on early detection and prompt treatment. The model aims to ensure that all children should be able to access high-quality services in an appropriate location within an appropriate time frame, irrespective of their geographical location or social background. The model of care explicitly supports the development of the new Children's Hospital and an integrated national network for paediatrics with strengthened and interconnected roles for local and regional paediatric units, including the regional unit in Cork University Hospital. As the Deputy is aware, there are a number of distinct phases within the proposed paediatric development at CUH. The HSE is responsible for the delivery of healthcare services, including infrastructure projects, and has advised that the Phase 2 development, which includes 74 inpatient beds, is currently at the design stage and is funded up to the detailed design and planning stage in 2019. I understand that a capital submission for Phase 3 of the development is currently being prepared in order to enable the scheduled construction of this project during the construction of Phase 2. The submission will have to be considered by the HSE's Capital Steering Committee before it can be approved. I am happy to confirm that the paediatric development at Cork University Hospital has been included in Project Ireland 2040 policy initiative announced last year. This provides €10.9 billion for health capital developments across the country, including both national programmes and individual projects across acute, primary and social care. The delivery of these projects and programmes, including developments in Cork, will result in healthcare facilities that allow for implementation of new models of care and for delivery of services in high-quality modern facilities. My department and the HSE are currently engaged in a process to finalise the HSE capital plan for 2019. In developing its capital plan for 2019 and future years, the HSE must consider a range of issues, including the expenditure that is contractually committed, the HSE's annual requirement in relation to meeting risks associated with clinical equipment, ambulances and healthcare infrastructure. The HSE capital plan will propose the projects that can progress in 2019 and beyond, have regard to the available capital funding, the number of large national capital projects currently underway, the cash flow requirements attaching to each project and the relevant priority. Projects that are currently in construction and are contractually committed will not be affected. Once the HSE has finalised its capital plan for 2019, it will then be submitted to the Minister for consideration.
Thank you for your reply. And look, overall, you haven't given any additional reassurance that the project will be funded to Phase 3 and beyond. You're saying it's included in the Project Ireland 2040 initiative. That's little comfort to those who are waiting for this investment. I assume what you're referring to is the National Development Plan, which still has a long number of years to run. So I think it's important to say, Minister, that without this investment, paediatric care in Cork will continue to be delivered inefficiently across two sites, Cork University Hospital and the Mercy University Hospital, and surgical services for children will continue to be provided in a scattered way across three sites, those two hospitals and the South Infirmary University Hospital. Children's surgeries are performed in the middle of adult lists with no guarantee of having anaesthetic, surgical or theatre staff trained in the care of children. So the reality is that this project must advance. I acknowledge it's funded currently, as you say, up to Phase 2. But what we need now is a capital commitment from the HSE and from the Government to ensure that this project can actually move through detailed design, tender construction and that the specialist care can be provided locally. The consequences otherwise, Minister, are that more and more of the cases that are currently being dealt with in Cork will end up having to travel to Dublin. And that's not just an inconvenience, but the National Children's Hospital, expensive and all as it is not designed to absorb additional capacity which is currently being met on a regional basis in places like Cork University Hospital. So, it's not very often that clinicians come to us and really explain the urgency of a project. And for the children of Cork, Kerry and the wider area, the development of this paediatric unit is urgent. I would hope that you, as Minister, will lend your full support to get this over the line and make sure it just doesn't end up at the back of a long queue of projects. Thank you.
Thank you, Deputy Minister, to conclude.
Deputy, thank you, and I appreciate the attention you're bringing to this, and you've outlined very eloquently the importance of this particular project to the future of, as you said yourself, not just Cork but the entire Munster area. And just to assure the Deputy that I and I'm sure many other deputies in the Cork area are very anxious to see this progress as well, in line with a number of other capital projects that are committed for County of Cork in healthcare. both from a community level and indeed at an acute level, and a different range of services that are all necessary, and we're all watching the capital plan as it progresses. You will appreciate that I can't give any further commitment other than what I've already done to say that it is funded up to detailed design and planning for 2019, but that we have to let the HSE do their work with the department to finalise a capital plan for 2019, and I can't go outside that and start confirming individual projects until the totality is there. But to assure the Deputy that I do appreciate the chance and the opportunity that you have given to air the necessity and the import of this particular project, and I certainly will be supporting you wholeheartedly to ensure that we get delivery for the good people of Munster into the years ahead. Gormagat, Kilcorla.